Deputy Billy Kelleher.
Yeah, just to ask the Minister for Health the number of deaths caused by drugs and if he will provide a specific figure for those involved involving methadone in each of the past 5 years, and if he will make a statement on the matter, and if we just might have a broader discussion in the context of the methadone treatment programme itself.
Drug-related deaths are a human tragedy for the families and friends of the people involved and have a considerable impact on communities and society as a whole. While there are no easy solutions to addressing the problem, the Government is committed to stepping up the effort to reduce the number of drug-related deaths. The latest annual figures from the National Drug-Related Deaths Index indicate that 350 people died in 2012 due to the toxic effects of drugs. That was a decrease from 387 in 2011. There were 86 deaths involving methadone in 2012, as compared to 118 in 2011, 60 in 2010, 69 in 2009 and 80 in 2008. Methadone was involved in 1 out of 4 poisoning deaths, and in most of these deaths methadone was mixed with another drug. Many drug-related deaths are avoidable, and particularly those involving methadone or heroin overdoses. For this reason, I have now authorised the HSE to undertake a demonstration project for the use of Naloxone in the prevention of opioid overdose. Naloxone reverses the effect of drugs like heroin, morphine and methadone in someone who overdoses. The pilot, which is being carried out this year, aims to increase access to Naloxone for non-medical staff, such as families, friends and workers, people who work with drug users. The HSE budget also includes an extra £2.1 million to support this project and to target vulnerable drug users, including the provision of additional residential detox beds and additional rehab facilities. My department is commencing work on the development of a new national drug strategy for the period after 2016. The process will involve comprehensive consultation with stakeholders and the public on the current national drugs policy and future priorities. It will also take account of evidence-based research, information and data sources to the extent that and nature of the problem drug use in Ireland, including drug-related deaths.
Thank the Minister for his reply, and I welcome the fact that there is a commitment to actually carry out a review of our drug treatment programmes in place in the drug strategy. Let's be very clear, Minister, this has fallen off the political agenda. And that's lots of people's fault. But I mean, the key issue here is we do have a major situation with regard to drug abuse in this country, and it is escalating on a continual basis. But in regard to opiate substitutes, I mean, have you looked at the whole area of buprenorphine as another option? I mean, there seems to be a continual dependency in our treatment centres on methadone itself. And I'm just asking him, but I do think that we have to look at other options. It seems to be the case that we're just satisfied as a people to give them methadone and hope they don't annoy us on the street. And I do believe we have to look beyond that. They're people, they need support, they need assistance. And I just think that collectively we should try and come to some consensus to see how we can address this issue. And Professor Farrell's 2010 report did come up with various views on opiate substitutes, and I'm just wondering, are we very channelled or blinkered in our approach and completely dependent on methadone in terms of providing the treatment for heroin and opiate addicts?
Minister.
Yeah, look at the objective is to reduce the number of number of drug deaths, and at least for the years for which we had the most recent figures, the number of drug deaths has gone down slightly. The two things that will happen this year, which I hope will improve the situation, is number one, the Naloxone project, making that available to users, their families, friends and people who work with them, to reverse overdoses, and I think that will actually be the single most effective thing we can do to save lives. And of course the second thing that we're doing, which is very important, is increasing the budget for drug treatment, increasing the drugs budget by over £2 million this year, which will include additional needle exchanges and additional detox beds to allow people who want to come off opioids altogether and go clean. And that's why those additional beds are being provided. Indeed, some additional ones are being provided in my own constituency in Ashley House and Coolmine, which is particularly targeted at drug users who are pregnant or have young children. And I visited that centre and seen their work, and you know, I'd certainly like to see. Very happy with the fact that I've been able to provide additional resources for Merchants Quay and for Coolmine and for others this year, and hope to be able to continue to do so in the coming years.
Thank you.
Just very briefly, Minister, I don't expect you to answer it if you don't know, but I just would ask, in the context of rolling out the Naloxone programme over the next while, will Garda stations and other places, in areas of high drug usage, have that available as well? Because it just seems to be the case that while we make some efforts in the whole area of treatment of heroin addicts and opiate addicts in particular, we just seem to be happy enough just to give them the methadone and hope that they go on their merry way, and that they just don't annoy us anymore as a society. And I don't think collectively that's good enough. We have some people who are on methadone for up to 20 years. 20 years. I mean, we have to look at other options to try and ensure we give them every assistance in trying to address their drug addiction. And I don't believe that just handing out methadone alone, with other supports, detox programs, but also looking at other substitutes and giving heroin users options in trying to treat or deal with their addiction, is something that we haven't done in recent times. So I do welcome the broader issue of a full review of our drug treatment systems in place in this country as well.
Yeah, look at long-term methadone maintenance may be the best option for some people. It's certainly not the best option for everyone, and that's why we are increasing the number of detox beds this year. And we will certainly look at all those issues in the context of the next National Drug Strategy, and I'll very much welcome your input into that. On your specific question about the Naloxone demonstration study, initially it's aimed at non-medical staff, care workers, families and peers of opioid users. I think it's already the case that paramedics can use Naloxone. When it comes to the Gardaí and prison officers, of course that would require a willingness on their part to be part of this project. It's important that obviously there is consent, and it is intended at some point to have that discussion with them and include with them if appropriate.
Thank you.